Hello, my name is Tony Ngo. I'm a student nurse practitioner. I'm going to be doing a head-to-toe assessment on you today. I'm just going to wash my hands. My name is Tony.
Hi, I'm Allison.
Okay. Very nice to meet you. So first we're going to go ahead and assess your head. I'm just going to palpate your head. Does it hurt anywhere around here?
Nope.
Nope. So the head appears to be normal cephalic. There's no masses or lesions. The hair distribution is even, dark, shiny. Next, I'm going to palpate your frontal sinuses. Does this hurt anywhere around here?
Nope.
Okay, and I'm also going to palpate the maxillary sinuses. Any pain around here?
Nope.
All right. The eyes appear to be symmetric. The ears are also symmetric. There's no abnormal lesions or masses. And lips appear to be symmetrical as well. Next, I'm going to be going to assess your eyes. So first of all, I'm going to take a general look at your, so the eyelids appear to be normal. There's no abnormal drainage or exudates. The eyelash distribution is even. The eyebrows are symmetrical as well. I'm just going to go ahead and pull down your eyes. The conjunctiva are pink, scleras are white, there's no injection. The irises are brown, and the cornea appears to be clear. Next, I'm going to have you hold this about 14 inches from your face. It's a Snellen eye chart. Go ahead and read the smallest one you can see for me.
DEFPOTEC.
All right, so that's about 20/20. And so we're taking cranial nerve 2, which is intact. Next, I'm going to go ahead and take a look inside of her eye. Really quick, go ahead and just look straight forward for me. I'm going to go ahead and shine this at your eye. And as you can see, the corneal light reflex is normal. The light is pinpoint in the same spot in both eyes symmetrically. I'm going to shine this at your eye one more time. And the red reflex is normal as well. Next, I'm going to go ahead and take a look inside of her eye. So go ahead and just look straight forward for me. I'm going to look right into the right eye. The disc margins are sharp, approximately 1.5 millimeters in size, and the color is a yellowish orange. Next, I'm going to go ahead and look in the left eye. Go ahead and do the same exact thing, straight forward for me. All right, and it's about the same. The disc margins are sharp. It's a yellowish orange color with a disc size of about 1.5. Next, just go ahead and keep looking straight forward for me. I'm going to go ahead and shine this light into your left eye. All right, pupils are equal. Reactive to light, it constricts from about 4 millimeters to about 2 millimeters. Go ahead and look at my finger. And accommodation is intact as well. Next, I'm going to go ahead and take a look at her ears. We're going to take a quick look at the exterior. The ears are symmetrical bilaterally. There's no obvious drainage from either side of the ears. I'm going to palpate the pretragus and the auricles. Does that hurt at all?
No.
All right. Next, I'm going to go ahead and take a look inside of each ear. All right. In the left ear, the TM is pearly gray. It's fully visualized. It's at about the 5 o'clock position. Take a look inside the right ear, and the TM is also intact. It's a pearly gray color. There's also no large amount of cerumen, and the TM is about 7 o'clock. Next, I'm going to go ahead and assess her neck. So just basically looking at the neck, there's no masses, there's no obvious pulsations, it's symmetrical, there's no lesions or masses. I'm going to go ahead and just palpate. Does that hurt at all?
Nope.
Any pain back here?
Nope.
Nope. So next I'm going to actually palpate the cervical lymph nodes. We're going to go preauricular, postauricular, submental, submaxillary, tonsillar, superficial cervical, deep cervical, and then the supraclavicular. There's no tenderness, there's no masses. and there's no lymphadenopathy. Next, I'm going to go ahead and do me a favor, go ahead and swallow. All right. So as you can see, the thyroid actually moves when the patient swallows, which is normal. And that also assesses for cranial nerve 12, which is intact. Next, I'm going to deviate the patient's trachea to the left side, and it's going to palpate the thyroid. There's no abnormal enlargement. I'm also going to deviate the trachea to the right side and also palpate as well. There's no abnormal enlargement of the thyroid. While I'm doing that, I'm also going to palpate the carotid, which is 2+, it's normal, and also on the left hand or on the right hand side. And next, I'm going to take a look at the patient's mouth and throat. Do me a favor, go and stick out your tongue. All right, perfect. So that's actually going to assess for cranial nerve 12 as well. Cranial nerve 12. Next, go and open your mouth for me. All the patient's teeth are intact. They're present. There's no cavities or anything. The mucomucosa is intact. The gums are pink. There's no abnormal lesions on the tongue. Next, if I had a tongue depressor, I would take a look at the back of the patient's tongue and elicit a gag reflex, which would be normal because the patient's able to swallow. The tonsils are about 2+, and there's no erythema to the posterior pharynx. Also, what I forgot to do earlier is we're going to take a look at the patient's nose. I'm able to visualize the turbinates. They are pink and moist. There's no obvious deviated septum. Go ahead and do me a favor. Can you obscure your left nostril and blow out? All right, and do it on the other side as well. Perfect. So as you can see, the patient's nares are patent bilaterally. Next, we're going to go ahead and check your cranial nerve 1, which is your sense of smell. So go ahead and do me a favor, and can you go and smell that? Tell me what it is.
Lavender.
Perfect. Next, we're actually going to go ahead and assess the patient's thorax. We're going to start with the posterior thorax and then work our way to the front. First, we're just going to do a general inspection. The patient's back, thorax posterior actually is symmetrical. There's no abnormal pulsations. The spine appears to be midline. There's no abnormal curvature. Next, I'm going to go ahead and auscultate the lungs and 8 lung fields across the back. It's going to be in a Z pattern. Take a deep breath. Deep breath. Deep breath. Take a deep breath. Deep breath. Deep breath. Deep breath. And last time. Perfect. Right. And then next what I'm going to do is I'm going to go ahead and auscultate in the same areas again, but every time with the stethoscope, I want you to go ahead and say E for me, okay? All right.
E, 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 E.
So all lung fields are clear to auscultation. There's no crackles, rails, wheezing noted. The gophony is normal as well. There's no consolidation. Next, what I'm going to do is I'm going to have you repeat the words 99 as I move my hands along your back, okay? Go ahead.
99, 99, 99, 99.
Perfect. That's checking for tactile firmitis, which is also normal. There's no signs of consolidation. Next, I'm going to go ahead and put my arms along the small of your back. Each time you take a deep breath, my hand should expand. That's checking for your chest expansion, which is symmetrical bilaterally, okay? Also, in terms of the general assessment of the back, there's no accessory muscle use, there's no retractions, there's no dyspnea. Chest rise is symmetrical, and there's also no tachypnea noted. Next, I'm going to go ahead and put my hand over your right flank. I'm going to go ahead and tap it. Does that hurt at all?
Nope.
We're going to do the same thing on the left side. Does that hurt at all?
No.
All right, perfect. That's checking for coastal vertebral tenderness, which is also normal as well. Next, I'm actually going to go ahead and percuss along your all your lung fields, and what we're looking for is resonance, which is normal, okay? And we're going to go from medial to lateral. Perfect. Next, we're actually going to go ahead and assess your anterior thorax. What I'm going to do is go ahead and listen to 4 lung fields in the front. And we're also, before I do that, I'm actually just going to note that there's no retractions, there's no accessory muscle use, chest rise is equal, expansion is symmetrical, and there's no abnormal or obvious pulsations. Deep breath. Okay. One more time. And last time. Perfect. All right. Along with auscultating the anterior thorax, there's no adventitious lung sounds such as crackles, rails, rhonchi, or wheezing. Next, we're going to go ahead and move on to the cardiothoracic portion of this exam. First, I'm going to go ahead and palpate the 5 pericardium spots on the patient's chest. So first, on the right-hand side, on the second intercostal space substernally, we are going to go and palpate the aortic valve. There's no thrills or heaves. Next, we're going to go across the sternum to the left second substernal intercostal space, which is the where the pulmonic valve would be. There's no thrills or heaves as well. We're going to move down to the left third intercostal space substernally and palpate the Erb's point. There's also no thrill or heave. We're going to move down to the left substernal fourth intercostal space and palpate the tricuspid valve. There's also no thrill or heaves. Next, we're going to go down to the point of maximum impact, which is the left fifth intercostal space. So it's a left midclavicular fifth intercostal space. There's also no thrill or heave noted here. Next, I'm going to go ahead and auscultate those 5 same spots with the patient sitting upright with both the bell and diaphragm. So S1 and S2 are heard. There's no S3 or S4 heard, no gallops, murmurs, rubs, or clicks. Next, I'm actually going to go ahead and auscultate the same exact spots with the patient laying flat on their back to assess for any other murmurs that might be present that are positional. And again, of course, for the video, where I'm only showing with the diaphragm, but I would do it with both the bell and diaphragm. Next, I'm going to actually have you go ahead and lay on your left side facing the camera that way. And again, I'm going to go ahead and auscultate at the same 5 spots. And again, there are no, there's no murmurs, clicks, S3 or S4 heard at any of the spots. Next, I'm going to go ahead and have you sit up. We're going to go ahead and check all of your pulses. So first, I'm going to check both your radial pulses. All right, and these are 2+ bilaterally. Next, we're going to go ahead and check your brachial pulses bilaterally as well. These are 2+ as well. Next, we're going to go ahead and check the patient's femoral pulses. The right side's going to be 2+, and the left side as well is going to be 2+. Next, we're going to go ahead and check both the, I'm going to remove your sandals. We're going to check both of the patient's dorsalis pedis pulses, which are also 2+ as well. And we're also going to check the posterior tibial pulses as well, which are also 2+ as well. And then next, we're going to go ahead and assess the patient's abdomen. Allison, can I have you go ahead and lay down? Perfect. So in a normal patient scenario, I would, of course, lift up the patient's gown, take a look at the abdomen, check for any ecchymosis, abnormal pulsations, discoloration such as cyanosis or pallor. But for this scenario, we're going to go ahead and keep the patient's shirt down. Also, we note for any lesions or abrasions as well. Next, we're going to go ahead and auscultate the patient's abdomen. We're going to start from the right lower quadrant, and we're going to go in a clockwise motion. Normally, I would listen for 1 minute in each section, but for time's sake, we're just going to go ahead and do a quick auscultation of the abdomen, okay? And while we're auscultating the patient, I'm actually going to go ahead and switch over to the bell. We're going to listen to the patient's aorta, which should be lateral of the umbilicus. And we're also going to take a listen to the patient's renal arteries, which will also be above the umbilicus, but more lateral than the aorta. Next, we're also going to take a listen to the patient's iliac arteries, which are located below the umbilicus, but lateral as well. And lastly, we're also going to take a listen to the patient's femoral arteries, which are also more laterally above both of the thighs, though. And lastly, because we didn't auscultate the patient's carotid arteries earlier, we're going to go ahead and do that now. Allison, I want you to go ahead and take a deep breath for me and hold it. Perfect. Go ahead and take a breathe, and we're going to take a listen to the left side as well. Perfect. So there are no bruits noted to the patient's aorta, renal arteries, iliac artery, femoral arteries, nor the carotid. Next, we're going to go ahead and move on to the palpation portion of the abdomen. We're also going to go in a clockwise motion around the abdomen. Initially, we're going to first go ahead and do a light palpation. This is to check for any areas of tenderness. So go ahead and tell me if it hurts anywhere, okay, Allison? Okay. Any pain with that?
No.
No? Okay. Next, we're going to go ahead and do a deeper palpation. This is assessing for any masses or deeper areas of tenderness. So go ahead and tell me if it hurts anywhere, okay? Any pain?
No.
Perfect. Next, we're going to go ahead and percuss the general abdomen. We should hear a mixture of both tympany and dullness. This is due to the bowels and different organs in the area. Okay. All right, that sounds perfect. Next, since we are percussing, we're going to go ahead and percuss the patient's liver span. So what I'm actually going to do is start to the lower abdomen, and we're going to go ahead and work our way up until we hear an area of dullness, okay? And then, so there's a dullness right there. We're going to go ahead and go up to the fifth intercostal mid-clavicular line. We're actually going to go work our way down and measure from until we hear dullness as well. All right. So that space is actually going to measure about 6 centimeters on Allison, which is normal. Next, we're going to go ahead and check for her left costal margin. This is going to assess for any splenomegaly. And it's non-palpable, which is also a normal finding. Next, we are going to go ahead and do a few tests that are actually specifically checking for appendicitis. First, the most common test known is McBurney's point. So it's actually about from where the umbilicus is and the ASIS joint. It's about 1/3 of the distance from the umbilicus. We're going to just press down firmly. Is there any pain there, Allison? No? Perfect. Next, we're actually going to go ahead and check for psoas sign. So what happens is the psoas, when it is contracted, actually puts pressure on the appendix and would elicit pain in the patient. What I'm going to go ahead and do is put pressure on the patient's right knee, and I'm going to go ahead and flex your knee up, Allison. All right, is there any pain right there in that right lower quadrant? Perfect. Next, we're going to go ahead and check for Rovsing sign. Rovsing sign, we're actually going to go ahead and put pressure on the left lower quadrant of the abdomen, and the patient may have referred pain in the right lower quadrant. Are you having any pain over there? Perfect. Next, we're going to check for obturator sign. The obturator muscle is below where the appendix is. So by causing the obturator muscle to contract, the patient may also have pain. Bless you. So what we're going to go ahead and do is, Allison, go ahead and bend your knee for me, and then we're going to go ahead and internally rotate that right hip. Are you having any pain down here?
No.
All right, perfect, and that's normal as well. Next, what we're going to do is we're going to go ahead and palpate the inguinal nodes. Is there any tenderness down here? There's no palpable lymph nodes. There's also no hernia noted as well. And next, we're lastly going to do Murphy's point. So what I'm going to have Allison do is I'm going to go ahead and palpate right below the right costal margin. Go ahead and take a deep breath for me. All right, and then we're going to relax, and one more time. All right, and then we're going to go and push in right there. What happens is the lung presses against that gallbladder. Are you having any pain right there? And it would elicit pain if it was irritated. Allison, next we're going to go ahead and check your cranial nerves. So I'm actually going to have you sit right up for me. Perfect. So we already checked cranial nerve 1, which was your sense of smell. We checked your cranial nerve 2, which was your visual acuity. Next, we're going to go ahead and check cranial nerve 3, 4, and 6, which are your extraocular movements. So I'm going to go ahead and have you focus on my finger and go ahead and follow the moving finger. Perfect. All right. So cranial nerves 3, 4, and 6 are intact. Extraocular movement is normal. Next, we're going to do the cover-uncover test, which checks for strabismus of the eye. Go ahead and just look forward for me. I'm going to go ahead and cover your eye. Remove it. Perfect. There's no gaze deviation, which is perfect. We're going to do the same thing on the other eye. Perfect. Next, we're going to go ahead and check for cranial nerve 5. We're going to go ahead and tell me if it feels the same on both sides.
Yep.
All right.
Yep.
Perfect. And we're going to go ahead and check cranial nerve 8, which is for your hearing. We're going to do first the Weaver test. All right. Does that sound the same on both sides?
Mm-hmm.
Perfect. Next, we're going to go ahead and do the Ryan test. It's going to go right behind the bone on the backside of your ear. Can you peer and feel that?
Mm-hmm.
All right. Tell me when you stop feeling the vibration.
I stop.
Can you still hear that?
Yeah.
Perfect. So her air conduction is greater than bone conduction, which is perfect. We're going to do that on the right side as well. All right, tell me when you Stop feeling the vibration, stop hearing it.
Stop.
And can you still hear that?
Yep.
Perfect. So cranial nerve 8 is intact. Cranial nerve 9 and 10 also are part of the swallowing and gag reflex, which were normal. Cranial nerve 11, I'm going to go ahead and have you shrug your shoulders out. Perfect. And cranial nerve 12, we already checked also as well with the swallowing. Next, lastly, we're going to do cranial nerve 7. I'm going to have you smile. All right. Lift up your eyebrows. Close your eyes real tight. Puff out your cheeks. All right. So cranial nerve 7 is also intact as well. Next, we're going to go ahead and check Allison's reflexes. So what we're going to first do is check her bicep reflex. So we're going to go ahead and have you relax. All right, that's 2+. We're going to go ahead and do that on the right side as well, which is also 2+. We're going to go ahead and do the triceps reflex as well. And we're going to do it on the right side as well. Relax. Perfect. And then we're going to check the brachioradialis on both sides as well. Okay. Which are also 2+ and symmetrical bilaterally. We're going to check the patellar reflex. Which is 2+ and bilaterally equal. And we're going to check the Achilles reflex as well, which is also 2+ bilaterally. Allison, can I have you go and kick your feet up real quick? We're just going to check your Babinski reflex. So we're going to go on the lateral aspect of the foot, and we're going to hook around the ball of the toes. And that's a normal reflex because we want all of her toes to actually curl down. Perfect. Okay, and next we're going to go ahead and assess Allison's gait. So Allison, if you don't mind, go ahead and stand up and walk normally for me. Right. So her gait's normal. There's no limp, no antalgic gait. Go ahead and I want you to walk heel to toe for me. All right. Coordination is intact. And next we're going to go ahead and check your Romberg sign. So go ahead and put your toes together and close your eyes for me. And at the same time, stick your arms out and hold them out in front of you. Perfect. So Romberg's test is also negative as well. And as you can see, there's no pronator drift. Perfect. Next, I'm going to go ahead and have you take a seat for me, Allison. We're going to go ahead and have you go ahead and alternate touching each finger to your thumb on both sides. Perfect. So motor coordination is intact. And then go ahead and grip my fingers. Tick, tick, tick. Perfect. Grip strength is 5 out of 5 bilaterally. Go ahead and lift your shoulders. Don't let me push you down. Perfect. That's also 5 out of 5. Go ahead and kick your knees out. Perfect. Same thing on this side. Perfect. And then go ahead and lift up your feet for me. Go ahead and push down like you're on the gas pedal. Perfect. 5 out of 5. And lift up your toes. 5 out of 5. And a few more tests to check for your coordination and cerebellar function. We're actually going to have you do a heel to shin test. So go ahead and put your left heel or right heel to your left shin and drag it down and back up. And opposite on the same, on the other leg. Perfect. And next we're also going to have you go ahead and take your fingers and alternate touching your nose. Perfect. So coordination and cerebellar function appears intact. Next we're going to go ahead and check for sterigenosis. Go ahead and close your eyes for me and put out your left palm. I'm going to put something in there. Go ahead and tell me what that is.
A bottle cap.
Perfect. And then go ahead and open your left palm again. I'm going to go ahead and write a number in there and tell me what number it is.
7.
All right, and your right hand, go ahead and tell me what that is.
Did you write it again?
Yes.
8.
Perfect. So next we're actually going to go ahead and assess your range of motion of your extremities. So while you're sitting up, we're going to go ahead and check your shoulder range of motion. So go ahead and put your arms up behind the back of your head. So flexion and external rotation is normal. Go ahead and put your arms behind your back. Extension and internal rotation of the shoulder is normal. And go ahead and put your arms above your head. Abduction is normal, and put your arms back to your side. Adduction of the shoulder is normal as well. Next, I'm going to go ahead and have you alternate your palms up and down. Supination and pronation of the elbow is normal. And go ahead and bend your arms forward, flexion, and extend. Perfect. Next, we're going to go ahead and have you abduct your fingers and adduct your fingers together. Perfect. And go ahead and extend your wrists, both of them for me. Perfect. And flex your wrist for me. Perfect. And go ahead and do a radial deviation, so inside the middle, and ulnar deviation to the lateral side. Perfect. And next, we're also going to check the range of motion of your neck. So go ahead and flex your neck down for me. Extend it backwards. Bend to the left. And then bend to the right. So lateral flexion is normal. And then go ahead and rotate left and right. Full range of motion of the neck. Perfect. Next, we're going to go ahead and I'm going to go ahead and have you lay down for me.
Does it matter which way?
You pick. All right. And so for your knee, go ahead and bend your knee for me. Perfect. That's flexion of the hip and knee. And then go ahead and extend it. Perfect extension. Same thing on the left side. Right, back down. Perfect. Next, I'm going to have you go ahead and bend your knee again. And bend your hip into the all right, and then back out. External rotation is normal. Go ahead and straighten out your leg. And then we're going to have you lift your right leg out towards me. Abduction is normal, and pull back in. Adduction is also normal. Perfect. We're going to do the same thing on the left leg. So going to have you go and bend up, flexion, external rotation, internal rotation, and then we're going to have you straighten out your leg, and then go ahead and abduct out laterally, and adduct medially. Perfect. And I just want to note there, patient has a couple surgical scars on both knees. There's no edema to the lower extremities, and hair distribution is normal. There's no obvious lesions or abrasions. Next, we're going to go ahead and take a look at your feet. Go ahead and lift your toes up towards the ceiling. So you're going to dorsiflex and then push down. You're going to plantar flex. And go ahead and bend your big toes inward to invert them. Perfect. And then we're going to go opposite to evert. Perfect. Next, we're going to go ahead and just palpate all the patient's joints and assess. Any tenderness?
Nope.
Tenderness. Hip is stable. Any tenderness? Nope. Any tenderness here? And any tenderness here. Perfect. So there's no tenderness, warmth, or swelling to any of the patient's joints. We're going to go and take a look at the patient's nails. Kind of squeeze them. Cap refills less than 3 seconds. There's no cyanosis or clubbing noted. We're going to do the same thing on our toes. Cap refills also less than 3 seconds. No cyanosis or clubbing noted as well. Next, we're going to go ahead and assess the kneecap. We're going to go and just palpate around for any swelling. Does that hurt at all?
No.
No. There's no swelling, tenderness, or edema. There's also no warmth to it. Next, we're going to go ahead and do the anterior and posterior drawer test. So we're going to have you bend your knee up, and then I'm going to go ahead and anteriorly pull the knee. Any pain? We're going to push forward posteriorly. Any pain? So there's no laxity in the joint, which is normal. Next, we're going to go ahead and have you relax down to a 30-degree angle. I'm going to go ahead and support the thigh and the calf. We're going to push laterally, checking the valgus. There's no laxity. And we're going to switch arm positions, and we're going to go ahead and do Valrus, which is also normal. There's no laxity. Next, we're going to go ahead and do Lachman's. I'm going to support the thigh. I'm going to just relax. And there's also no laxity there. We're going to repeat the same process on the left knee. There's also, is there any pain with this? No redness, pain, or swelling. We're going to go ahead and have Allison bend her knee at a 90-degree angle. We're going to go ahead and pull anteriorly. There's no laxity. And we're going to push posteriorly. So the Joyce test is normal, no laxity. Next, we're going to relax Allison's leg to a 30-degree angle. And we're going to do the valgus test. There's no laxity. We're going to switch arms and do the varus test, which is also negative. There's no laxity. Last, we're also going to do Lachman. So we're going to support Allison's leg, go and relax. And it's also normal. There's no laxity. Perfect. All right, Allison, the last thing I'm actually going to have you stand up for me. And we're going to have you bend over, so we're going to take a look at your spine. So there's no scoliosis noted, no kyphosis, or lordosis as well. All right, thank you, Allison. That concludes the head-to-toe assessment. All right, thank you.
Thank you.